The purpose of this video is to raise awareness among people about the do's and don'ts of managing obesity. Let's find out how to fight the obesity. Obesity is considered a complex medical condition that involves an excessive amount of body fat that can negatively affect a person's health. It is commonly associated with an increased risk of developing various health problems such as heart disease, stroke, diabetes, and certain cancers. Therefore, obesity is often classified as a disease due to its potential impact on an individual's health and well-being. Obesity can have a wide range of negative effects on health. Increased risk of chronic diseases. Obesity increases the risk of developing chronic diseases such as diabetes, heart disease, stroke, and certain types of cancer, joint pain, and osteoarthritis. Excess weight puts added pressure on the joints, leading to pain and increased risk of osteoarthritis. Mental health issues can include depression, anxiety, low self-esteem, sleep apnea. Obesity increases the risk of sleep apnea, a condition where breathing stops and starts during sleep. Fatty liver disease. Obesity can cause fatty liver disease, which can lead to liver damage and other health problems. High blood pressure. Obesity increases the risk of high blood pressure, which can lead to heart disease and stroke. Reproductive issues. Obesity can lead to infertility and other reproductive issues in both men and women. Increased risk of complications during pregnancy. Obese women are at a high risk of developing complications during pregnancy, such as gestational diabetes and preeclampsia. There are certain guidelines to be followed in order to do self-screening of own weight. In case of any significant issue, one can consult a physician or take measures. Certain changes in diet and in lifestyle are recommended to bring a significant improvement. Increase intake of fruits and vegetables. Fruits and vegetables are nutrient-dense, low in calories, and high in fiber, which can help promote feelings of fullness and reduce overall calorie intake. Aim for at least 5 servings of fruits and vegetables per day. Nuts and seeds are rich in healthy fats, protein, and fiber, which can also help promote satiety and reduce calorie intake. However, they are also high in calories, so it's important to eat them in moderation. Choose lean protein sources, such as chicken, fish, and legumes. These can help support muscle mass and metabolism, which can be helpful in managing obesity. Avoid processed foods. Processed foods tend to be high in calories, unhealthy fats, and added sugars, which can contribute to weight gain. Opt for whole, unprocessed foods instead. Practice portion control. Even healthy foods can contribute to weight gain if consumed in excess. Be mindful of portion sizes and aim to eat until you feel satisfied, not overly full. Making lifestyle changes can be an effective way to reduce and manage obesity. Increase physical activity. Regular physical activity can help burn calories, increase muscle mass, and boost metabolism, which can be helpful in managing obesity. Adopt practice of having moderate exercises on a daily basis. It's important to reduce sedentary behavior such as sitting for long periods of time. Manage stress. Stress can trigger emotional eating and unhealthy food choices, which can contribute to weight gain. Engage in stress-reducing activities such as yoga, meditation, or deep breathing exercises. Get adequate sleep. Lack of sleep can disrupt hormones that regulate appetite and metabolism, which can contribute to weight gain. Aim for at least 7 to 8 hours of sleep per night. Seek support. Managing obesity can be challenging, so it's important to seek support from friends, family, or a healthcare professional. Remember, managing obesity is a journey that requires patience, dedication, and consistency.